Welcome to Breathe California TV. My name is Terry Trumbull. I'm a volunteer for the Lung Health Organization for California. Today we're talking with Dr. Alan Goldsobel, who's a member of Breathe California's board. We thought we probably were long overdue on an explanation of how your lungs work and how problems like asthma or air pollution occur. So we'll be talking with Alan about that. So this is an introduction to your health, how your lungs work. See you in 30 seconds.
It's given me a chance to go out and be with people who has the same problem. And it helps you to manage your life better too, because you hear different things from each person. And it's just been really helpful in many ways.
Welcome back. This is Breathe California TV. I'm Terry Trumbull. I've been a volunteer helping Breathe California for a number of years, and I hope you will call into the phone number on the screen and volunteer yourself. Last year, we helped 150,000 people with breathing difficulties, and believe me, that number will be higher if you come help us. But today we're going to be talking about how your lungs work, leading to some prevention, how we might avoid damages. And nobody's better than a doctor who's an asthma expert, Dr. Alan Goldsobel, who's also on the Breathe California board. Welcome.
Thank you, Terry. Thanks very much.
So how did you decide to get on the board? I know you're busy and working like crazy on a variety of things, not just your practice. What brought you to Breathe California?
Being an allergy and asthma specialist, I've always taken care of patients who had respiratory problems. And I had known Margot, was the executive director till she just recently stepped down, and just thought it was a natural for me to be involved in the organization and to help more with patients who have respiratory problems.
Well, my recollection is I left the board about 3 years ago, and you must have been on for at least 5 before then.
Right,
so your work has really been appreciated. So tell us a little bit about your practice, where you based at, and you mentioned it's asthma and allergy. Maybe a little description about what that means for patients.
Sure. I'm an allergy, asthma, immunology expert or specialist. I'm in a group practice called Allergy and Asthma Associates of Northern California. We have offices throughout Northern California where we see patients who have chronic upper or lower respiratory tract problems, allergies. It's the springtime right now, and allergies have been very bad. A number of patients have asthma, which is an inflammatory process of the lower respiratory tract. We see a lot of patients who have chronic sinus infections, lung infections, hives and other skin problems as well. And these days, a lot of food allergies as well.
Yeah, it's pretty amazing. You go to Breathe California's office on Park Avenue in San Jose, and they got flyers on 13 different lung problems. So our audience here is San Jose and Campbell, although anybody can watch on demand. Where's your closest office?
We have an office on Moore Park Avenue, right near 280 and Saratoga Avenue, right at the corner of Saratoga and Moore Park Avenue,
and
is our main office.
Very close to Valley Medical then.
And very close to Valley Med, exactly.
So I used a term that I don't understand that might be a starting point. We have this wonderful chart from Breathe California, but what's it mean, upper and lower respiratory problems?
We think of the respiratory tract as being the nose and the sinuses as the upper respiratory tract, as we can see on the picture right here, and connecting to the lungs or the lower respiratory tract through the trachea, the windpipe, that connects through the bronchial tubes to the lungs. One important point is that it's all one airway, it's all one system. And so if the upper respiratory tract of the nose and sinuses are inflamed, that often will secondarily cause problems with the lung and vice versa. So we do think of it at all as one connected airway, which it really is. The lungs exist or developed to bring oxygen into the body and give off carbon dioxide back into the environment. So we breathe air through the nose. The lungs like to have air breathed through the nose, not through the mouth, into the lungs through the bronchial tubes. There are 23 different generations or splits of the bronchial tubes each time.
So just to translate into English that a lawyer can understand. So that means each of these airways
will split.
Are what you're calling bronchial tubes.
Right.
Yes.
So these are the bronchial tubes. These are the main stem bronchi, they call it, and then they get progressively smaller and smaller and smaller. And we call each split like this a generation. And there are 23 different splits or generations until you get down to the very tiny, tiny, tiny small airways, which lead to the alveoli or sacs. Everybody remembers learning about the sacs or the alveoli in school. The alveoli are where the real function of the lungs occur, which is to bring oxygen, absorb oxygen out of the air, and breathe out carbon dioxide that comes from the bloodstream that goes right by these sacs. So the blood sends carbon dioxide out, brings oxygen into the body, and that's how we oxygenate and the entire body, which is a fuel for the body, if you will. And so when there are problems with the airways or the respiratory system, it can involve either the tubes themselves, such as bronchitis or asthma or COPD, chronic bronchitis, that form, or it can involve the sacs themselves. If you get pneumonia, that's typically an infection of the sacs, and emphysema is a chronic destruction of the sacs where they don't absorb oxygen very well any longer.
So emphysema particles might cause that where they're permanent. I've seen pictures of healthy lungs which are white and black lungs
right.
which aren't.
Right.
Would you call that an emphysema characteristic where they're blocked, or?
I mean, the real characteristic about the emphysema is that under the microscope, these airways are severely damaged and destructed and just don't function well at all anymore. And that's what leads to the severe breathlessness that the patient gets. The overall term of COPD, chronic obstructive pulmonary disease, includes both patients who get chronic bronchitis, which is coughing predominantly, and a lot of chronic inflammation in the bronchial tubes, and then that classic emphysema where you're just severely breathless, where there's been literal destruction of the tissue of the sacs.
So what would cause that destruction of the sacs? It obviously sounds really disastrous.
Well, it is, and for patients who have emphysema, it's a quite severe disease to live with, and unfortunately, COPD is a common cause of death in the United States and in other countries. In the vast majority of cases, COPD is caused from smoking, tobacco smoking, or any type of combustible smoking. As states are approving marijuana, and as medical marijuana is being used in the United States, theoretically, with enough exposure to the combustion of burning leaves, that can also cause eventually destruction of the tissue.
Yeah, I was amused in my city's paper this morning. People are astounded that the city's ban, in this case, on smoking inside of apartment buildings applies to marijuana. But the health consequences are the same?
Exactly. They're essentially the same. And breathing in, there's a particulate matter. When you smell smoke, be it marijuana smoke, tobacco smoke, that is a particulate matter that is extremely irritating to the upper airways, to the eyes, and to the lungs in the lower respiratory tract. One of the reasons that the lungs are so impacted by the environment is that it's estimated that with these 23 generations and all these sacs, that the surface area, meaning the entire surface, if you laid it out on the ground, the surface area of the lungs would be equivalent to a tennis court. That there's that much surface area inside the lungs. So there's a huge area that we as human beings are coming into interaction with the environment. And so when there's air pollution, when there is pollen if you're allergic, when there are irritants in the airway like smoke, tobacco smoke, that has great effects on the lungs. And then secondarily, other organs, the heart and other organs in the body as well.
Well, you've left us about 40 directions to go, but great news sounds like bad news here. You talked about the total surface area being the size of a tennis court. That has got to mean for people that get it obstructed due to causes like smoking, have really, really had to do an awful lot to contaminate that much surface area.
That's true. That's a good point. That as we know, it takes in most people a number of years of smoking to create damage in such an extensive area that you're now really impacted and having daily difficulty breathing. So I think the good news there is if you are smoking, it's never too late to stop. And if you do stop smoking, the ongoing damage is halted. You can't really reverse the damage that's been done, but no more damage is being done once you stop smoking.
So we're talking with Dr. Alan Goldsobel about your lung health. We've got a lot more left to discuss, and I don't know about you, but there's a whole bunch of revelations to me here that I never get from my doctors. So I'm quite happy I don't have to pay Alan a fortune for this learning experience. See you in 30 seconds.
The nice thing about Better Breathers Club is we go in and there's other people sitting around with oxygen. It's almost a relief that everybody looks the same in the room. It's a funny thing to say, but it's a good feeling. Breathe California means having resources available to us that will help guide us and make our lives easier.
Welcome back to Breathe California TV. You know, in the medical world, most of the nonprofits, the organizations involved, are treating damage that's occurred, and we're talking with Dr. Alan Goldsobel about how the lungs work. I chair the prevention committee where we're trying to do what we can to reduce air pollution and smoking and the other things that cause the kind of damage. I think you pay attention the next 10 minutes and like me, you're going to learn a lot more about how to protect your health, and not just for your lungs, but also your heart. So I just said that. You want to defend it or tell me I'm full of it?
No, that's absolutely true. I think that prevention is definitely where it's at. We would love to do away with some of these diseases and some of these conditions, and if we could eliminate smoking in the environment, in the population completely, that would be better. We've done a lot of work here in California, better than in other parts of the country, but we still got a lot of work to do for prevention.
For regular tobacco, I think our county's like 8% when 1988 we were in the 30s.
Right.
So it's been a big improvement. So I made a tie-in, how would abuse like smoking of the lungs impact the heart? Because you hear from heart organizations that smoking's the worst thing for causing cancers of the heart.
Absolutely. Smoking has effects on the entire body in the lungs because it causes damage to the tissue it makes it harder for the heart to push the blood through the lungs. The heart pushes the blood or sends the blood through the lungs to get rid of the carbon dioxide and bring in oxygen. But if there's, if you will, hardening of the arteries in the lungs and destructed tissue, the heart has to work that much harder, which puts a big strain on the heart. Smoking also causes constriction of blood vessels everywhere in the body, which then leads to high blood pressure, more work for the heart starts to fail after a while. So it's difficult for the entire system.
So there's a logic behind it, but one of the things that always surprises me is the heart and lungs are more connected than the rest of the body. If I recall my physiology from the dawn of time, that there's a separate set of arteries that serve just the lungs and then another set for everything else.
That's absolutely correct. There are four main...
The body hasn't changed since I went to college?
It has not changed in the least. It's gotten better, Terry. There are four main blood vessels that either leave or come into the heart. So there's one that collect the veins. Remember, are the blood vessels that bring blood back into the body. So there's all the veins collect and bring blood back into the heart, and then from there the heart sends the blood out in an artery to the lungs. That's called the pulmonary artery, and then a pulmonary vein drains the blood from the lungs back into the heart. Now it's been oxygenated, and from there the heart pumps it back out into the body through the aorta, which we all have heard of, the big roundish tube that then takes the blood through the arteries out to the rest of the body.
So let's talk a little bit, maybe from start of it, the upper system down, the filtration system. So for starters, how did this develop? You pointed out that the lungs are for oxygen.
Right.
Why did we have a filtration mechanism evolve around that?
Well, I think the theory is that there's always been irritants in the environment from the caveman time of smoke or volcano ash and dust, and so there was this evolution of trying to keep bad things out of the body and let the body normal functions proceed as such. So even the hairs inside your nose is the first line of filtration that keeps the largest particles out.
So to gross everybody out, I shouldn't be cutting those all off?
Well, only the ones that come outside, Terry. Those
Thank
you can cut off. And then the cilia are the little microscopic like hairs that are lining the entire respiratory tract from the nose and into the sinuses down into the lung. Those cilia constantly beat in the mucus that lines the bronchial tubes and the nose and sinuses, and the cilia moves things up. So if you do get a particle past the nose or past the larger hairs, they collect it, or bacteria or other things that you might breathe in, and send it back. The cilia in the nose go down toward the throat. The cilia in the lungs come up toward the throat, and you swallow that mucus down into the stomach, and the stomach acid destroys it. It's estimated that normally the average adult swallows a quart of mucus a day between the nose and the lungs. So when you're feeling, oh, I've got so much mucus in the back of my throat, that's when it's gone over and above that normal 1 quart a day.
So this is a pretty amazing system, because it has filtration to stop things from getting in the lungs, and then it has a mechanism to get rid of anything that gets past those filters.
Right. I mean, the body will take anything that does get into the body, and then we have the immune system, which is I like to think of that as the armed defense of the body, the army. The immune system is a very vast system in the body that consists of many individual cells. Often you heard about the white blood cells or lymphocytes that are coursing throughout the body. They're often housed in places like lymph nodes that you'll feel when you get a sore throat. These glands get swollen because your body's making more white blood cells to fight it off. your immune system is constantly coursing throughout the body, trying to differentiate anything that is considered non-self, anything that it doesn't recognize as being part of me, it tries to destroy and get rid of. As well as the theory is that we are constantly, that cells are being created in the body that would be considered cancer cells, but the immune system recognizes that and kills it off, and it doesn't go anywhere further than that.
So this is just part of how you're educating me and hopefully the audience is getting. You know, I always thought of immune cells as something zipping around in the blood system, but you're saying it's in lymph nodes, which I always knew could have that kind of reaction. I just didn't but they're pervasive throughout the body. They aren't just in the blood.
They are pervasive throughout the body, as well as the immune system is very strong at the edges of the body, right where the body comes into contact with the external world. I like to think of the analogy, if the United States is going to be attacked from the outside from another country, we want to take them on at the borders in California or in the East Coast. You want to wait till they get to Omaha or Kansas City before you start to fight them off. So the immune system is like that along the everywhere where the body comes into contact with the external world, which is the skin, the lining of the upper and lower respiratory tract, and the lining of the gastrointestinal tract. That's where the immune system is especially strongest to take up the attack and fight anything that's getting into the body that shouldn't be there.
Anything got by the boundaries, in essence.
Exactly.
So the filtration mechanism would imply to me that some things that we kind of view are gross, like coughing or blowing our nose, might actually be good.
No, that's a good point. It is good when you have excess secretions. It is very good to get those secretions out of the body. So blowing your nose to get rid of a lot of mucus. A lot of young children have very difficult times getting the mucus out. Salt water flushing or irrigation of the nose and sinuses helps to get rid of excess mucus and particles and irritants that have gotten into the body. And breathing in either medications or even salt water can help to clear excess mucus and secretions from the lungs as well.
So just be blunt for one last thing. We talked about this off air, but why don't I want to breathe through my mouth rather than my nose?
The nose is there to both warm and humidify the air. The lungs like air that is at body temperature and at a certain level of moisture.
So through your mouth, you're in essence bypassing, if nothing else, because it's a much wider airway.
It's a wider airway. It doesn't humidify as well, and it doesn't moisturize as well. And so the lungs don't like that air as much. So the person who's chronically congested in the nose will even start to feel a little difficulty with their breathing just because they're only breathing through their mouth.
So we're going to have you back for more of this, because
Absolutely.
We're barely going to touch the areas that you're an expert on here. But what causes asthma? We have a stupendous number of people with it. Our next guest, Amanda Montez, was talking about how bad her problems were in LA, but they don't exist here.
Right.
What's this all about?
Asthma and other allergic diseases is very interesting as to why they're increasing so much in our society and other Western societies in the world. The leading theory, certainly the high levels of air pollution that we experience here in the United States and in many other industrialized countries, is a big part of that. But it even goes back further to what's called the hygiene hypothesis, that we are being born into too clean of an environment, and that when infants are born and get all their vaccinations, they don't get sick very much, and they're not getting any serious kind of infections, their immune system is kind of sitting around with nothing to do, and so it starts to fight off things that it really shouldn't have paid any attention to, like pollen or dust mites or animal danders. If you're born in a country where you're around a lot of animals and you're exposed to animals and their fecal material, that stimulates the immune system of infants to not go off into this allergic or asthmatic state.
So I gather what you're suggesting would be better off if all newborns were taken to farms?
Well, they show pictures that in Germany, farms the farmhouses are connected to the house where the family lives. And you can see the mother with the baby on her back shoveling like cow manure, and right here is a door, and there's the kitchen. And with that close exposure, they get exposed to things that are very strongly stimulating the immune system. In America, even in farms, the animals are far away from the living area, and the living area is still relatively clean.
So we got about a minute and a half left, so I want you to kind of do the same discussion on allergies for about a minute, and then we'll do a wrap-up. So differences between allergies and asthma.
Allergies, again, it's that specific reaction of your immune system against things that it really shouldn't be concerned with, like pollen or dust or animals or foods. And it can occur, again, on the reaction can be on the skin, in the upper or lower respiratory tract, or in the gastrointestinal tract are the main places that allergic symptoms occur or allergic diseases occur. And we try to help people to learn to avoid those things in the environment as best they can.
So 15, 20 seconds left. Some sort of summary about how to protect our lung health?
Well, please stop smoking. If you know people who are smoking, don't have your kids exposed to cigarette smoke is the best thing. Buy alternatively fueled vehicles are better for the environment. And please come out and support Breathe California.
So we've been talking with Dr. Alan Goldsobel, a member of Breathe California's board, asthma and allergy specialist. See you next week.